CCS 101.1 FM and AM 1160. And Dr. Michael Sauter is with us this morning. Our conversation brought to you by Marcus and Mack, a law firm representing injured people. There probably is not a topic we ever cover from a medical viewpoint here on Indiana in the Morning that has so many different connections to practically every aspect of your health than heart health, and that includes neurology. And Dr. Sauter is a neurologist. Good morning to you.
Good morning. Thank you.
It's good to have you back in the studio with us today.
It's been a little bit of time here.
A little bit. There is a very, very strong connection between neurology and heart health, though, isn't there?
Yes, there is a very strong correlation between patients who have heart disease and patients who have cerebrovascular brain disease. Just about a one-to-one correlation.
Yeah, and it's amazing to me the ramifications of that. If your heart is healthy, I think the CDC put it healthy heart, healthy brain, unhealthy heart, unhealthy brain. Absolutely.
When we interview patients who come in for a midlife check, mid-50s, early 60s, first question, of course, that we would ask is, do you have any history of heart disease? Because that gives us, as neurologists, an insight into what the relative risk is of having cerebrovascular risk, that is stroke risk.
And stroke is really one of the primary areas that you look at when you consider brain health and its connection to heart disease.
Absolutely. The issues in regards to stroke deal with not just the motor or sensory or language problems of stroke, but also cognitive or thinking problems in the patient who has suffered a stroke.
Is there actual connection between heart disease and dementia?
There is more of a direct correlation between cerebrovascular disease, stroke disease, and dementia. You can have either vascular dementia, which is multiple strokes accumulating over the course of time leading to cognitive or thinking impairment, or you could have a mixed dementia syndrome in which you have Alzheimer's dementia, and concurrent with that you have vascular dementia from either very small but multiple strokes or a very large strategically located stroke.
Okay, let's explore this a little bit. So the connection is almost a literal pipeline from the heart to the brain, isn't it?
Right. Where you're asking about what is the likelihood that the blood vessels supplying the heart are diseased, and what is the correlation between similar blood vessels in the brain being diseased or narrowed? And there's a fairly direct, strong correlation.
And we're not necessarily talking about complete lack of blood getting to the brain, but even if it slows down, if it trickles, if there's some sort of issue going on there, that the amount of blood getting to the brain is a problem, then that becomes a real difficult prospect too.
Right. What you're seeing in that regard is something called a watershed infarct, where if you have blood flow but inadequate blood flow to supply all the neurons in the brain, then there are regions in the brain that become injured, and those are what we call watershed regions, in between the large vascular territories, which are supplied a little bit by one territory and a little bit by another. And so if you have too low of blood flow to that general region, then those overlapping or watershed areas become most vulnerable to damage.
Let's talk a little bit about stroke and how one recovers from it. We've talked before with some of our others about the prevention of stroke and looking for the signs of stroke. Let's talk about what physically happens to your brain and the possibility of recovery of some lost skills or lost areas of your brain when you have a stroke.
Right. When you have a stroke, you tend to lose function that relates to the area of brain injury. So, for instance, if you have a stroke in the frontal cortex of the brain, you generally lose strength or fine motor dexterity in that limb so affected. And so what you would want to do is get involved with physical therapy. And we have plenty of good physical therapists in this region to help overcome the deficits or accommodate the deficits and compensate for them to improve mobility or improve strength, to improve coordination or dexterity. On the other hand, if you have a stroke that affects the language or communication area, you turn to speech therapists They help both with language and swallowing and conceptualization. So we're very, very valuable extenders in the healthcare community in this area in particular that help to overcome the deficits of a stroke.
Mm-hmm. We have heard in the past about the importance of getting your stroke, if you have suffered a stroke, of getting to the hospital and getting it taken care of quickly, and the possibilities of full recovery increase the quicker you get there, correct?
Right. Time is brain. That's been the mantra of the American Heart Association, American Stroke Association over the last 30 years. And that means that if you're having a deficit, the sooner you get into the hospital, the sooner you get blood pressure under control, the sooner you get the problem addressed either with a clot-busting drug such as TPA or a thrombectomy procedure where they snare the clot and take it away from the vulnerable area, the more likely it is that you will have a substantial recovery. Mm-hmm. So it's key to getting in earlier, as soon as possible, rather than deny it or go to sleep on it and say, well, things will be better. That's too optimistic approach to this very critical health issue. We want you to bother us. We don't mind. We don't mind in that regard.
I remember you saying that before when you were here, that we would love to have you come in and pester us a little bit about it.
Yep, that's that. We will never shut the door on you.
And it's really important for folks to do that, because people do. They say to themselves, well, it's no problem for me. I'll go another day.
It's a typical defense mechanism on the part of each and every one of us, not just the patients in the periphery, but physicians and other healthcare specialists do the same thing. They deny. They make light of it, or they don't think that it really could pertain to them, where in fact it pertains to all of us. And so the key is picking up the phone and calling EMS, picking up the phone and calling 911, or going to the ER. The ER will accommodate you. They will evaluate you as if you may be having an acute ischemic or hemorrhagic stroke, and they will take the necessary actions in conjunction with the neurologist in this area and the neurologist, if necessary, in Pittsburgh as well.
You emphasized at the beginning of our conversation how it is important for you to establish with patients who have heart disease the brain connection with them. What are some of the diagnostic ways that you can look and say, okay, you've got the heart disease and here's the effect it's having on you right now?
Right. Well, that very question lends itself to, why would you get a carotid ultrasound? Why would you get an echocardiogram? The echocardiogram is an ultrasound of the heart, and it looks primarily at the valvular function of the heart, but it also looks at the strength of the heart muscle and how well it performs as a pump, pumping blood to the rest of the areas of the brain and to the kidneys and to the GI tract. But also, if you have heart disease, we want to know if you have irregular heart rhythms that have developed either spontaneously or as a result of damage to the heart from pre-existing heart problems, because that would be treated in a different way with blood thinners. But it's a very, very high risk of stroke, and we really need to identify that as one of the complicating factors of heart disease.
You mentioned high blood pressure. That is certainly an indicator. And there are other indicators that you could be headed down the wrong road.
Right. High blood pressure, diabetes, sedentary lifestyle, smoking. Those are what we call modifiable risk factors. And so it's one of those things where shame on you or shame on us as screening physicians if we don't look for those problems, because those are correctable problems.
Yeah, and better to correct before they become an event than afterwards.
Absolutely. It's much easier to prevent and to move forward in life than it is to recover and rehabilitate after you have that misstep.
So you mentioned the midlife checkups that people should be undergoing, and you mentioned the 50-year age to early 60s age range.
Yeah, that starts to define really when heart disease becomes a significant impediment in your life. And then as you get into the 60s, that's when stroke becomes a major threatening impediment to your life and quality of life.
Yeah, absolutely. So it should start with your primary care physician?
Starts with the primary care physician. Take advantage of the community screening opportunities for blood pressure checks, for carotid Brewery checks, ultrasound checks. Get involved with the YMCA or other healthcare, health fitness programs so that you can improve your aerobic capacity and adjust your eating habits to minimize your cholesterol intake.
Yeah.
So these are all ways that you can kind of engage and empower yourself to take charge of this critically serious condition.
And then by the time they get up to your level of care, that means that something has been discovered, and now's the time to take care of it.
Right. By the time someone would be referred to me, it's because the alarm bells are going off on the part of family members or on the part of primary care physicians or ER physicians that something is potentially catastrophically wrong or potentially on its way to being a devastating condition.
Yeah, and we talk about the passage of time and how we can say to ourselves, I just had that done, but then it turns out that was 3 or 4 years
absolutely
ago.
Absolutely
right. and so staying on top of it is as much. Making that initial visit and those first steps, they're sort of like New Year's resolutions. They're easy to forget about after a little bit.
Too easy to forget about, but if you put it into a schedule, if by age 60 you're annually evaluating your own heart attack risk and stroke risk, then it's just like taking your car to the garage on an annual basis to say, is everything okay? Mm-hmm. Make sure I don't have a flat on the side of the road dark at night. Can I keep moving forward with an optimistic view on life and a robust level of health?
Make your inspection appointment, get a new fresh sticker.
Absolutely.
Dr. Michael Sauter, thank you so much for visiting with us today. There is a connection between heart health and brain health, and we need to pay attention to
Absolutely.
it.
Absolutely right.
Good of you to visit. Have a wonderful day today.
Thank you for giving me the opportunity.
It is the voice of Indiana County, WCCS 101.1 FM and AM 1160.